Well, hello and welcome to This Month in Hamilton, our February 2025 edition. I want to start out by thanking WBCB 1490 AM for allowing us each and every month to bring you what's going on this month in Hamilton, as well as our sponsors, Capital Health System, Haldeman Ford, Saul Funeral Home, and Kessel Dermatology. So we are in the month of February, Heart Health Month. Joining us today as our guest will be around after the break, Dr. Pirouz from Capital Health System to talk about everything we should be doing. Hopefully most of us are doing those kinds of things, right? To make sure we have a healthy mind, healthy body, but specifically healthy heart. So look forward to talking with Doc later in the show. We are recording this on February 25th. 60 degrees today. I know everybody's as excited as I am to maybe not walk out in 5 layers and a winter jacket and scarf and hat and all of that. It's certainly been a little bit of a colder winter. You're seeing that around town, right? So we've had a higher amount of potholes, and so our roads team is starting to fill as many of those potholes as we can get to. If we don't get to yours right away that you report in, please just give us a little patience. The fluctuating temperatures, the colder temperatures, they really beat up a road when you get that ice that freezes and thaws and then freezes again and gets run over. So if you see a pothole, make sure you report it in to Hamstat, and then our roads crew is now starting to fill a lot of those potholes. Something else we're looking forward to as we talk about roads is our annual St. Patrick's Day Parade. Many of you have probably started seeing the around town signs go up for the St. Patrick's Day Parade. So the parade is March 8th. It kicks off 1 p.m. at Nottingham Firehouse. The rain date is March 22nd. So we've had an unfortunate bit of luck the last 3 years. It's rained on the first date the last 3 years. Last year made the decision to go forward with it even on the actual date, even though it was raining a little bit. Wound up being the right decision because on the rain date it wound up pouring. So we've gotten the parade in all 3 years, right? But I think God needs to smile down on us a little bit and give us some good weather on the actual parade date this year. So be on the lookout for the annual St. Patrick's Day Parade again, March 8th. If you're not going to watch the parade, make sure you stay away from Nottingham. Make sure you stay away from Mercer Street. We have to close the roads down early. It takes a while to get the roads back open. So if you're not watching the parade, just stay away from those areas. Go early, go late, what have you, in terms of getting to those areas. And then we try to make a decision the Thursday before the parade to give all the marching bands and the like time to adjust their schedule if needed. So if it does look like there might be some inclement weather on March 8th, we usually try to make the decision in partnership with the St. Patrick's Day Parade Committee March 6th. So be on the lookout for that. But again, fingers crossed we get it off March 8th as we normally do. In terms of updates on the new municipal building, you are still seeing cranes in action. You're still seeing cement being poured. All that foundation work is still going on. It's again 100,000 square foot building, so it takes some time to do all that, and progress continues to be made. We hope by April you start seeing some pieces of steel go up. So fingers crossed on that, because once the steel's done, maybe by the end of the summer or early fall, that'll really allow the building to then really expand, as you can really start running electrical wires, running plumbing pipes, all that kind of stuff through the building at the same time. So be on the lookout for that. Some minor hiccups so far, just as we've had a slower season, but all good otherwise. So keep your eyes on the dirt piles, keep your eyes out for some steel as it starts to get warmer. Hopefully the rain lessens a little bit. Hopefully the little warmer weather helps a little bit, and we can really kick it back into full drive later this year. In terms of what else is going on, we're planning for Azalea Fest. So that'll be May again. Remember, last year was the first year we did it. the Saturday before Mother's Day. So you'll see that again this year as well. So it's May 10th that Azalea Fest is scheduled for. A rain date we do have of Mother's Day, but we want everybody to be able to enjoy Mother's Day weekend, so much so that we want our employees to be able to enjoy it too. So historically they've worked on Mother's Day. Having it the Saturday beforehand enables them to enjoy, if they're a mom, enjoy the day with their family, or enjoy the day with their moms or their spouses, and so we look to get that done the Saturday beforehand. In terms of what's going on otherwise this month in Hamilton, we continue to work on our budget for this year, so be on the lookout for that in April. It's as it always is, it's a process to get it to where it needs to be. And then we're really excited to start kicking off some of our projects that we're working on with the county, making some improvements to the Homedale School where we have nonprofits there. So hope to be able to put some new playground equipment there. I know we've really started to make some improvements in playgrounds over the last couple of years, obviously partnering with Where Angels Play 2 years ago to update Limewood Park, partnered with Where Angels Play again last year to update Apollo Park. We did an update to Connecticut Avenue, and now really looking at updating Homedale Playground as well, where the Homedale School is, and where we have a bunch of nonprofits as well. And the council just applied for funds from the state to make improvements to Switlick Park. Specifically, that it'd be an inclusive playground. We're trying to gear it more towards children with maybe developmental disabilities, autism, things like that, so that it's a sensory safe space, it's a inclusive space for maybe children who can't participate maybe in a louder environment in some of the bigger playgrounds, or need a barrier-free kind of space for themselves as well. So we've done that a little bit with Apollo Park, we've done that a little bit with Limewood Park, but this would be, our thought is geared more towards sensory safe playgrounds in Switlick Park. So we just applied for that grant. Hopefully we get that from the state and take it from there. So again, you're going to really start seeing some roads projects now in the spring as well. We talked about potholes, right? But our first big project this year is going to be South Broad Street. Remember 2 years ago we did half of South Broad Street between Layler and the Circle. Those lanes heading westbound, southbound, they call it north and south, even though to me it's more east and west, so I can never remember which way to call it. But now we're doing the other lanes heading in the other direction this summer as well. So you're going to start seeing mobilization of some of the equipment come March and April, so be on the lookout for that as there's potentially road improvements there. A lot of the actual road work will try to be done so it doesn't hurt with schools and morning traffic and all that kind of stuff, but there will be some inconvenience, but on the back end you'll get a better road on the back end of it. We're also planning to announce soon, and I can talk about it here, 1.3 million in grants from the state of New Jersey to update Klockner Road. So 2 different sections of Klockner Road, one section from Nottingham Way, where the Wawa is, all the way up to the train station. So that whole stretch that goes past like Hamilton Building Supply, Klockner Elementary School, that we got a grant for, so we're hoping to get that work done next year. And then another stretch from the State Police Barracks, so right around the 195 overpass down to 130. So 2 different sections of Klockner Road, kind of almost on 2 different, literally the 2 ends of Klockner Road, right? But those 2 grants total about 1.3 million. Those roads are in tough shape. You've got it in your Hamilton Building Supply where it's 1 lane in each direction, and then you've got it down by the Home Depot and the like where it's 2 to 3 lanes in each direction. So 2 big projects, right? 2 main thoroughfares in town, 2 well-traveled roads. So we just got those grants at the start of this year, but those will be projects that won't go until 2025. So, or excuse me, it already is 2025, 2026. So a lot going on that way as well. And then we continue to monitor everything that's coming out of the federal government in terms of grants, everything that's coming out of the state in terms of this budget cycle with grants, right? So We're not anticipating as much grants as we've gotten in the past, right? We've really been hitting it hot on grants. $1.5 million for the library, $750,000 for improvements to the Homedale building, $400,000 for different improvements from the county that we've gotten. So we've gotten millions of dollars in grants from through various programs, but unfortunately we're expecting that to slow a little bit. So our goal right now is strike while the iron's hot, get these projects done, get them in, get these improvements made, right? We got a $1.4 million in part of last year's state budget for something very sexy, a new roof at our police headquarters, right? But it's important that the men and women serving us have a dry place to go to work. But we're expecting some of that to slow. So you'll really start seeing those projects happening this year, maybe a little bit next year as well. But we do expect it to slow down into the future. So with that, we're going to take our first break. And again, joining us after the break will be Dr. Pirouz from Capital Health to talk about a little bit about him, but more importantly, what he's doing, what he's seeing, right, with his patients and the like, and talk about healthy hearts. So we'll be back in just a moment, and stay with us.
Kessel Dermatology in Hamilton Square is an award-winning dermatology practice led by Dr. Daniel Kessel, a board-certified dermatologist. He and his expert staff treat patients of all ages. They offer treatments of all types of skin, hair, and nail conditions, and annual skin cancer screenings, anti-aging treatments, ultraviolet A and B light treatments, skin tightening procedures, Botox, and other treatments that enhance your skin's overall health and appearance. Kessel Dermatology is open Monday through Thursday, 7 a.m. to 6 p.m., Friday, 7 a.m. to 3:30 p.m. For appointments, call 609-890-2600. That's 609-890-2600. Or visit KesselDermatology.com. They're at 1700 Whitehorse, Hamilton Square Road. Kessel Dermatology. They're good! Hamilton Township in Mercer County is fortunate to have many fine businesses that serve our community. Saul Funeral Home is a fourth-generation family-owned business proud to support our local schools and community. Their compassionate and caring staff is there for you and your family. They'll bring the closure you deserve while also celebrating the life of your loved one. Visit their website at saulfuneralhomes.com. That's saulfuneralhomes.com. Saul Funeral Home at 3795 Nottingham Way, Hamilton Square. Your vehicle is in good hands at Haldeman Collision, Route 33 in Hamilton Township. They do it all at Haldeman Collision. Minor dents and dings, bumpers, windshields, major body, and frame damage. Free estimates, 24-hour towing, most insurance accepted, and loaners available. Haldeman Collision works with all makes and models. They'll go out of their way to getting your car back in brand new condition. Haldeman Collision, conveniently located 20 minutes from Langhorne, Princeton, and Ewing on Route 33 in Hamilton Township.
Well, welcome back to This Month in Hamilton. I want to again start out by thanking our sponsors, Capital Health Systems, Haldeman Ford, Saul Funeral Home, and Kessel Dermatology. So, Dr. Pirouz, welcome.
Thank you so much, Mr. Mayor. It's a pleasure to be with you.
It's a pleasure to have you. Thank you so much. So, I told our audience a little bit before your appearance, right? Doctor with Capital Health System, but just tell our audience a little bit about yourself, if you don't mind.
Sure. I work for Capital Health, one of the hospitals in our community. I've been with them for full-time now for about 16 years. Before that, I've been all over the Northeast United States. I lived in New York City. I did most of my schooling in Baltimore, and then moved to Philadelphia for residency training, and then I did fellowship, which is how you become a cardiologist, in New Brunswick in Robert Wood Johnson. So I've been in the area for a long time.
You're a Northeast guy through and through.
I'm a Northeast guy, yes. But we ended up settling in this area, and I've had my first real job was with Deborah Heart and Lung, which is not so far from here.
Yeah.
And then through them, I was able to join Capital Health. And I've been with them, like 16 years now, full time. I've never had the desire to leave. I feel like it's a great place to work and take care of patients. We feel like part of the community, the communities that we serve.
And Capital Health keeps growing. So, I mean, I'm sure you keep growing
we
too,
keep
almost. With
growing
that.
and expanding, but still we're kind of grounded in this area where, you know, other hospital systems, they are big chains. They're in the administrators maybe in North Jersey or Philadelphia, whereas our administrators, as you know, they're
In
they're
Mercer
right
County,
here.
yeah.
They're from here. They live here. They are from this community, which to me is a major plus.
Yeah.
And the very first office where I worked, and that's why this township, Hamilton, has a special fondness in my heart, was the office down the street on Whitehorse, Mercerville,
Mm-hmm.
which we've had that location even before I joined.
Oh, wow.
You may know the history better, but yeah. So I've been going to that location for 16 years now, and I've had a lot of the same patients who came to me at that time in 2008, 2009, and I've been taking care of them for that long, and it's just a special feeling, because I was young and maybe they were middle-aged, and now I'm middle-aged and they're getting older, but we've kind of aged together, and that's, I don't know, that's, you said about becoming a doctor, that's one of the, things about being a doctor, that's a special thing, to kind of take care of people and yet grow old with them and see how they do, and, just take care of them over time. And to me, that's a very special thing. To be actually have the same people too, part of the same community, same patients
Mm-hmm.
that I've known for quite a while.
So, I've got a 4-year-old, right? Today, she tells me she wants to be a mother and mother and a doctor. Last year it was a mother and a teacher, right? But when did you kind of know that, you wanted to go maybe into the medical field or be a doctor?
It was sometime in college. I really loved science. That was my thing. Humanities, I dabbled, was not really my thing. Social sciences, but science and biological sciences was my thing. And that plus all the things we talked about being a physician, about
Mm-hmm.
Making an impact in people's lives and just
Helping, right?
helping. That was meaningful to me. And my particular specialty, I was just drawn to it because I found it to be really interesting, and we can get into that a little bit about why I find it interesting, because there's so much that goes into taking of the care of the heart.
Mm-hmm.
It's such a complex organ, even though it's very small, but it's a vital organ, and it's very complex about the way it works, and just the science of it was really fascinating to me.
So you go to college, I assume some sort of bio or biochem major, whatever the case may be, right?
Biomedical engineering.
Yeah.
Actually,
And you're on now your path to be a doctor, right? So when did you kind of decide, hey, I want to go into cardiology, though?
So the way you become a cardiologist, and this is getting a little, maybe not of interest to the wider audience, but you finish medical school, and then you do 3 years of what's called internal medicine.
Mm-hmm.
So a lot of the non-surgical specialties go that path, where they do internal medicine, and then you can either become a primary care provider, or you do a subspecialty like nephrologist, who's a specialist that take care of kidneys, or a lung specialist, or a heart specialist, or a gastrointestinal specialist. So you do your 3 years of internal medicine, and then it's during that time where you're exposed to different specialties, and you get to see what interests you, and not just what interests you, but also what you're good at.
Mm-hmm.
Frankly, some of these specialties, I was like, it's just not me, like
not clicking, right?
It's not clicking. If I have to study like 4 hours a day just to get it, it's not maybe for me. But this one, not only I was good at it, but I got it, and it was really interesting to me, and that's how I ended up being a cardiologist. Now, a lot of your audience, a lot of your constituents obviously see cardiologists, and just as an explanation of what different types there are, I'm what we call a non-invasive cardiologist, which means my job is to see you in the office, you tell me about your symptoms, or we already have an established history. We make sure that you're on the right medication regimen for prevention. If you have symptoms, or if there's anything that's not quite right, we do testing. That must be very familiar to a lot of the listeners. So our tests tend to be a lot of stress tests, where we walk on a treadmill to see if you have good blood flow to your heart. We do echocardiograms, which is an ultrasound of the heart, a way to visualize the function of the heart. You wear heart monitors. So that's essentially part of a non-invasive cardiologist's job. There's a subspecialty of cardiology called interventional. Those doctors, if you were to come in with a heart attack, or if you're having heart type pain, they can do invasive procedures such as stents that can improve your symptoms. And then there is, so they deal with the circulation to the heart. There is another subspecialist type called electrophysiologist. So they deal with the electrical system of the heart. People who have arrhythmias, people who need devices like pacemakers and defibrillators. So that's so just to clarify, in case it's not clear,
Sure.
like as to what different types of cardiologists do. So I'm a non-invasive. I do testing. I do diagnostic testing. I see people in the office. I see them in the hospital when they get sick to come to the hospital, and that's the extent of what I do.
So I've heard it described a little bit. You've got your electricians, you've got your plumbers, right?
Right.
And your generalist kind
Generalists,
of thing.
exactly.
Yeah.
Yeah, so we got our plumbers and electricians, exactly. So they deal with different aspects of, it's become complex enough that it's hard to be good at everything.
Yeah.
So I couldn't, if you wanted me to do a catheterization, I haven't touched one in a long time, so I wouldn't be your guy. Or if you need a pacemaker, I wouldn't be your guy. There's someone who does it all the time and is really good at it. And so if you need one, that's the person I would send you to.
But I think that's great, not only for you and I'm sure other doctors to recognize, right? Like what I'm really good at, right? And what I'm not so comfortable with, that I want to make sure my patient still gets the best care and treatment, and I'm going to hand you off to somebody else, right? Like,
Exactly.
I think a lot of patients may not, just me generically, appreciate kind of what goes into some of that thinking behind the scenes, even on why they're maybe being transferred over to somebody else, right? Like you said, you've been seeing some patients 16 years, but they may need a procedure now where you're like, you've got to go to this person. It's not because you're trying to avoid something, you're trying to get them the best care too.
Exactly. And some of it may just be for a procedure alone. So I say to them, I'm still going to be your doctor. That I'll be your contact person. You call me with any questions. I'll be there for whatever you need. But just this one procedure, I'm going to have you, because I want the best care for you. I want to send you to somebody who's really good at this one procedure. And then once they're done, then you come back to me, and then we'll pick it back up. And I think that's the model that. But at Capital Health, we have. It used to be that, as far as in the heart specialists, heart specialty, we didn't offer the most advanced stuff, like cardiac surgery. We didn't have. We couldn't give you a defibrillator because we didn't have cardiac surgery. We couldn't do, like, if you had a blockage, unless you were in with a heart attack, we couldn't fix that blockage. We had to send you out. Those were mainly, one, safety issue, two, state regulations. But now, part of our growth has been over the past few years that we actually do have cardiac surgery. We do all sorts of things. The only things we don't do as far as the heart is really advanced things, like maybe a transplant or
Sure.
Artificial pumps like called ventricular assist devices. Those we would send you to a university hospital. Maybe at some point we will get that, but that's something that's, I think, important for our community, is that
Most of the care they need can be right here locally.
exactly. I'm not
Yeah.
going to send you to Philadelphia for something that we could do here. And even though they may be world famous, our care here is just as good as what you would get here, but you're closer to home. You don't have to go far. If your family wants to visit you, they don't have to drive an hour down 95. They can come and visit you here, and we're all much more accessible than the doctors would be at a faraway place, at the mecca of care. Whereas here, it's in many ways it's much more accessible. So I think that's something that to me has been a major benefit our growth the past few years, is that we can offer our community much more than we used to be able to.
And so much of that's like almost a mental health approach, right, to treating a patient, right? When they're closer to home, when their family's closer, when they can get those visits, it just makes people mentally feel better and more secure, which can help physically too.
Exactly. I
Yeah.
think if you know your doctors, if it's a doctor who's taken care of you for a long time, and now he's the same doctor who's seeing you in the hospital, I think that goes a long way to keep your mind at ease and keep you comfortable with the care that you're getting. Because you're going to go back to that doctor once you're out of the hospital. For instance, let's say you're in the hospital, whereas if you're down in a faraway place, you will never see those people again.
Yeah, exactly. And not to say they're doing anything wrong, they're giving you the best care too, but there's a comfort level with anything,
Exactly,
right?
yeah.
People talk about being in their comfort zone or out of their comfort zone. When you're closer to home, generically, you're more in your comfort zone, kind of thing. So what's it been like after the break? I want to talk just about Heart Health Month and what you're seeing, right? But what's it been like to be on this journey with Capital Health as it's continued to grow, right? And your practice has grown, and it's got to be rewarding to be able to help people in all sorts of different ways, like you said, you couldn't 15 years ago or so.
Right, exactly. I think it's been really fascinating to see how much we've changed just over the past 10, 15 years. And, we have an administration, like I said, who's committed to making sure our institution stays local, stays independent, and also offers as much as possible here locally. So I have no questions about our administration. I joined here, and I haven't really, our practice specifically, we haven't had anybody leave, which goes to show you, like, we like working for Capital Health. So,
and it makes it better for your patients too, right?
Because
they got that continuity of care and all of that as well.
If you have a revolving door of doctors who come and go, that I hear that a lot from patients from other practices that says, I knew this doctor for a couple of years and then he left, so I had to get established with the whole other crew, and then they left, and that type of discontinuity, I think, is a big can cause harm, honestly, because
something falls through the cracks.
And each time a doctor has to know your history and has to learn about you, they're human too, then they may not necessarily know all the details like a doctor who's taken care of you for a long time.
Yeah, I mean, you've probably got hundreds of patients, right? And seeing them once, twice, maybe 3 times a year, it's hard to, remember all that. But when you're seeing them every year continuously, it becomes more of a pattern, right? And easier.
Exactly.
Yeah. Well, doctor, we got to take a short break. When we come back again, February is Heart Health Month, and I want to really talk about kind of what you're seeing in heart health, right? And some of the things you want to talk about, but we're going to get to that. It's a big topic, so we're going to take our first break, and when we come back, we'll talk more about how to be heart healthy.
Capital Health's primary care network continues to grow, bringing its extensive option of locations to your neighborhood. Whether you're scheduling a wellness checkup or not feeling well, advanced medicine starts with a Capital Health primary care doctor at locations near you in Mercer, Bucks, and Burlington counties. To find a Capital Health primary care location that's convenient for you, visit capitalmedicalgroup.org. That's capitalmedicalgroup.org. Kessel Dermatology in Hamilton Square is an award-winning dermatology practice led by Dr. Daniel Kessel, a board-certified dermatologist. He and his expert staff treat patients of all ages. They offer treatments of all types of skin, hair, and nail conditions, and annual skin cancer screenings, anti-aging treatments, ultraviolet A and B light treatments, skin tightening procedures, Botox, and other treatments that enhance your skin's overall health and appearance. Kessel Dermatology is open Monday through Thursday, 7 a.m. to 6 p.m., Friday, 7 a.m. to 3:30 p.m. For appointments, call 609-890-2600. That's 609-890-2600. Or visit KesselDermatology.com. They're at 1700 Whitehorse, Hamilton Square Road. Kessel Dermatology. They're good. Hamilton Township in Mercer County is fortunate to have many fine businesses that serve our community. Saul Funeral Home is a 4th-generation family-owned business proud to support our local schools and community. Their compassionate and caring staff is there for you and your family. They'll bring the closure you deserve while also celebrating the life of your loved one. Visit their website at saulfuneralhomes.com. That's saulfuneralhomes.com. Saul Funeral Home at 3795 Nottingham Way, Hamilton Square.
Well, welcome back to This Month in Hamilton. Want to again start out by thanking our sponsors, Capital Health System, Haldeman Ford, Saul Funeral Home, and Kessel Dermatology. So, Doctor, when we were talking in the first segment, right, we were talking about, I described it, the electricians, the plumbers, right, but what a complex organ the heart is, right, and what goes into the heart. So, can you just, describe a little bit, right? As I know it's complex, you could probably go on for hours, right? But just some basics on what makes up the heart and describe it if you can.
Of course. So the heart, even though it's small, if you can just make a fist and imagine your fist, that's the size of your heart.
Wow.
In a healthy heart. Otherwise, if it's bigger than that, then there's something wrong. But that's typically what the size of your heart would be. But it's a complex organ because it has to pump blood through the rest of your body your whole life. Your heart started pumping when you were a fetus at around, it's actually a lot earlier than a lot of people think. It's actually at 2 to 3 weeks of gestation.
Wow.
That heart starts beating, and it's a muscle. It's a big muscle. There's no hard parts. It's just one big soft muscle that has been beating for all of us ever since we were a 2-week fetus. And because it's a muscle, it's in a way similar to the muscle you have in your legs and your arms. The difference is that the muscles in your legs and arms can get tired, and you have to rest them. The muscle in your heart can never get tired. It has to beat continuously your entire life. If it ever gets tired and it stops, that's the end of life.
Yeah.
So it's really important for the heart to be able to get as much nutrition as it needs all the time, enough oxygen, and be able to get rid of the toxins and the carbon dioxide for the entirety of your life. And so the job of the blood vessels to the heart is to supply that oxygen and the nutrients continuously to your heart without break. So those blood vessels are called the coronaries, and when we talk about coronary disease, we're talking about disease in those blood vessels that supply your heart. Over time, sometimes you can get plaque buildup because of things like cholesterol and blood pressure and sugar and smoking and just lifestyle changes, bad food, poor diet, poor exercise. You can get plaque buildup on the inside of those blood vessels that can grow over time. And once they get thick enough, those plaques, blood cannot get through. So imagine like a hose that's obstructed. You know, if you put your thumb on a hose, blood can't get through, or flow can't get through. So, and because your heart is so dependent on having constant supply of nutrients and oxygen, again because it has to beat constantly, the heart doesn't like it when the blood flow gets obstructed. And so you may end up with chest pain, you may end up with shortness of breath because the heart's not able to pump effectively if it doesn't get enough oxygen. And so sometimes that can be a sign of coronary disease if you have chest pain, breathing problems, things like that. Now, along with coronary disease, sometimes those plaques can actually break off and cause a much bigger clot, and that can acutely close the blood flow, whereas you're sitting here doing fine. All of a sudden the clot breaks off and completely cuts off the blood flow to a big part of the heart. Now that's a heart attack, as opposed to what you had, which was stable coronary disease before. Now this is a heart attack. Stable coronary disease we can treat with medications and maybe stents, but an acute heart attack, like when a blood clot breaks off, that's an emergency. So for that we treat them with blood thinners, and we take them to the lab and we do an angioplasty. Those are all different types of coronary disease that you can get, and we can talk later about symptoms of heart disease and what to look for. So that's the plumbing part. The muscle of the heart itself, there's conditions that can cause the muscle of the heart to be weak, whereas a normal heart can squeeze effectively. There are some conditions that can weaken that heart muscle, so the heart muscle either doesn't pump effectively or it doesn't fill normally. And because that heart is not able to supply your body with blood flow, those can cause symptoms too, like shortness of breath and things like that, or lightheadedness. So that's another type of heart disease you may get, is problems with the muscle of the heart. So we talked about the circulation, we talked about the muscle. The other type of very common heart problem that people get is problem with the valves of the heart. So the heart has 4 chambers, 2 on the right, 2 on the left, 2 on top, 2 on the bottom. Each of them comes with a valve that lets the blood go forward when the heart's squeezing, and closes so that blood doesn't go backward when the heart's filling. So in order for the valves to work properly, when the heart's squeezing, the valve has to open up all the way to let all the blood go forward. And when the heart's filling, the valve has to close all the way so that no blood goes backward. And that's how the heart functions effectively. One of the more common types of heart problem we get is problems with the valves. So you can have either way. Either the valve, because of aging or thickening of the valve, opens up only part of the way. So if the heart has to pump against this really tiny hole to get the blood out, people can have symptoms from that. Or it can be really bad for the heart because it puts a lot of strain on that heart. Or if instead of closing all the way, the valve doesn't close all the way, close part of the way, a lot of that blood that it pumped forward, now it's going to go backward. And so that also puts a lot of strain on your heart because it has to kind of work double, right? Every time it pumps blood forward, a lot of that blood ends up coming back. So the work of the heart becomes double, and so that causes a lot of problems too. So valvular heart problem is another type of thing that we commonly take care of. And then lastly, getting to the electricians, different parts of the heart have to beat in a very coordinated way. So for instance, the top chambers have to squeeze together. The bottom chambers have to squeeze at the exact same time. Otherwise, this is not going to be an effective pump. If there's a delay between the right side and the left side, that's going to cause problems with the blood flow. Even more, if you take the left ventricle, which is the big chamber on the left side that pumps blood through the rest of your body, the different sides of it have to squeeze at the exact same time. For instance, I guess the radio listeners can't see this, but if your heart chamber is like this, if they both come in together, that's very effective in pumping the blood out. But if one side comes in first and then the other side comes in a little bit later, that blood doesn't get pumped out effectively, and so people feel that as well, and we call that dysynchrony, which is an electrical problem of the heart. Sometimes that electrical system can slow down, sometimes it can cause fast arrhythmias. So those are what the heart problems that the electrophysiologists deal with. So when somebody comes in with symptoms, part of what we do is, based on the symptoms you're describing, if you have not had heart problems before, is what is the likely cause of what you're describing? Is it even a heart problem? Because if you say I'm short of breath, it may be a lung problem, it may be just deconditioning. A lot of different things can cause symptoms. So part of what we do is, could it be related to your heart? Or is there an obvious other answer? If it could be related to the heart, we use testing, such as if we're suspecting that you have plaque buildup in the blood vessels of the heart, we use a test called the stress test, where we put you on a treadmill, and we see if there's any evidence based on your EKG or pictures of poor blood flow to the heart. And if there is, then we say, oh, you probably have some plaque in your heart because you have the symptoms, and now we see part of your heart is not getting enough blood flow, so we can go in there and maybe open that up to help you feel better. If you're having symptoms such as your heart racing or you're passing out, that might be an electrical problem. So we use the test called the heart monitor, where we have you wear a heart monitor at home, and when you have your symptoms, we'll record what your heart does, and we'll see is this something that caused by a heart rhythm problem. And that's where our diagnostic testing comes in. So when you go see a cardiologist, depending on the symptoms, they'll have a discussion with you as far as what their appropriate test would be, so that they can give you a diagnosis and help you feel better.
Sure.
So part of what we do is help people feel better, but another really important part of what we do is help them live longer and live healthier. And for that, a big part of what a cardiologist does is prevention. And so prevention, if you look at how many people died from heart disease 50 years ago compared to how many die now, it's a lot less. It's a small fraction of what it used to be in the 50s and 60s. Part of that is we're just better at treating the sick people who are in the hospital. Like if you come into the hospital with a heart attack, we're better at treating that with our stents and things like that. But a big part of the difference between now and 50 years ago is also we're better at prevention. The fact that we don't smoke as much, that has gone a long way. And for that, I think we have to thank civic leaders such as yourself for coming up with things like indoor smoking bans. I think that made a big difference for a big part of the population. I don't know how old you are, but I remember when I was younger, I used to go out on weekends, and I used to come home, and my whole body would just reek of cigarette. I didn't smoke, but other people smoked cigarettes. And now we go out to a bar, and you can actually you don't smell smoke, right?
I can still vividly remember the first day I went into a bar. New York did the smoking ban before us, and my college roommate lived in New York, right? And I walked in and I was like, wow, so this is what it can smell like when there's no smoking inside, right? I mean, it was just a huge difference.
So things like that can go a long way, for prevention. Other parts of things that we're better at is treating people's blood pressure, because we know lower blood pressure is a good thing. We're going for lower cholesterol numbers. If you look at, mammals, for instance, the level of cholesterol that's normal for a normal mammal is much lower than what we have in our bodies, and that's part of obviously our lifestyle, modern lifestyles with the foods that we eat and our lack of activity and things like that. So we know that to get your cholesterol down to a really low level goes a long way. So that brings up, there's 8 things. There used to be 7, now 8 things where these are what we call modifiable risk factors, things that you can do to lower your risk of heart problems. Things we can't do anything about. Getting older, we can't do anything about. Men get more heart disease, we can't do anything about that. Family history, you get what you
Your
get.
genes are your genes,
Your
right?
genes are your genes. You can't change that. But there's things that we can do, and I think and there's evidence that if we get all those right, the chances that you will have a heart attack would be very, very small. So some of those things are things that you do on your own. You don't need a doctor for that. To eat heart healthy, you can discuss with a nutritionist, and you can read up about it. But it's not a medical issue. I can't write a prescription for eating healthy.
You can't write a prescription that says less fried foods. Or something
well,
like
I can
that,
tell you
know?
about that for sure. But the types of diets, and now recently we've gotten to the point where if I tell you don't eat eggs, it turns out there's a study tomorrow that says actually eggs may not be so bad. So we don't go by individual ingredients as much anymore, whereas the pattern of diet that you eat can be really important. So now there's a pattern of diet called the Mediterranean diet, which seems to be very good for your heart. It's a pattern of diet that emphasizes seafood, protein as a source of protein, and less red meat, less fried foods, less sugary foods, more nuts and high fiber foods and fresh fruits and salads and things like that. And if you like to give yourself a treat from time to time, I'm always okay with that. But I wouldn't want somebody to just have unhealthy foods every day.
Sure.
But only as a treat. If you like a nice ribeye from time to time, it's fine. But just make it once a week or something. So diet is important. So look up Mediterranean diet, look up the DASH diet. Those are diets that have a lot of overlap, but they're very helpful. Exercise can go a long way. We recommend half an hour of exercise 3 times a week, but to the best that people are different, their exercise abilities are different. Part of what we do is we can't give the same advice to everybody, but I say just push yourself and get tired. That's how you're kind of pushing yourself to the limit. So more than just leisurely walk, depending on your abilities, just get out there and walk. And again, coming back to our civic leadership, having good sidewalks, good, safe, usable sidewalks can be really important, can be really helpful to a community, and not just sidewalks that end up in a highway ramp or something. So
you don't want to give people a reason not to walk. You want to give them a reason to walk.
Right, have sidewalks that go somewhere where they want to go. And unfortunately, our modern societies are built, at least in this country, are built around what's convenient for cars, and that's what's convenient for get people to walk. And so what may end up happening is we get in a car and go buy a bottle of milk and come back home. And so I think keeping active, exercise is the second part of what we talk about. The third part is to keep a healthy weight. This is a complex topic, keeping a healthy weight. We used a number called the BMI, body mass index, which is very imperfect because it can miss a lot of people either way.
Simplified, right?
It's oversimplified, but it's something. So that's the number we use to tell you if you're healthy weight or overweight. But again, it's imperfect, but it's kind of what we got for now. And I think we're moving away from the idea that obesity is a moral failing, or you don't have willpower, you could just stop eating. Our modern society isn't built to keep us thin. Our modern society is the foods that are in front of us, the way the food gets marketed, just leads to being overweight. And I think if doctors get away from this idea of and I think we don't do that, but it's out there to be judgmental of somebody who's overweight, and just help them with their dietary choices and with their exercise. And nowadays we actually have medications that will help you lose weight. You've heard of, everybody's heard of Ozempic,
right?
And all that.
Yep.
So we help them get on those medications. So keeping a healthy weight is a third factor. Smoking, like we talked about. So those are things you can do on your own. You don't need a doctor for that. And the cardiac risk factors that the doctor could help you manage would be blood pressure, like we discussed. That's a big risk factor for getting heart disease. Cholesterol is another one. that we have very effective medications to lower your cholesterol to where they should be, and your blood sugar. And again, that's another one that diet and exercise goes a long way, but you may still need medications after that. The eighth one, so those are 7. The eighth one, sometimes some people say like life stressors, which I mention to people sometimes, but they're like, that's easier said than done.
Yes.
You can't manage your life you can't just wish your
Can't
life
just
stressors
turn your brain
to go
off
away.
sometimes, right?
So life stressors to the best that you can manage, and also another emerging risk that we kind of not think about as much as we should is sleep. To get good quality sleep is really important for your health overall and for your heart. And I think nowadays with all the electronics we have, and we all sleep with our phones, and we forget how important good sleep is for our health. So those are the things that we talk about in the office for prevention.
Awesome. Well, Doc, we got to take
ahead.
a next break, right? I know it was a lot of education, and we still got more to talk about. And I still want to talk about too, like what people might be thinking and when they should come see somebody like yourself or see you. But we got to take our last break. Otherwise, I get yelled at by the radio station. I don't want that life stress. So we're going to take a short break, and when we come back, we'll keep talking to Dr. Pirouz.
Capital Health's primary care network continues to grow, bringing its extensive option of locations to your neighborhood. Whether you're scheduling a wellness checkup or not feeling well, advanced medicine starts with a Capital Health primary care doctor at locations near you in Mercer, Bucks, and Burlington counties. To find a Capital Health primary care location that's convenient for you, visit capitalmedicalgroup.org. That's capitalmedicalgroup.org. Your vehicle is in good hands at Haldeman Collision, Route 33 in Hamilton Township. They do it all at Haldeman Collision. Minor dents and dings, bumpers, windshields, major body, and frame damage. Free estimates, 24-hour towing, most insurance accepted, and loaners available. Haldeman Collision works with all makes and models. They'll go out of their way to getting your car back in brand new condition. Haldeman Collision, conveniently located 20 minutes from Langhorne, Princeton, and Ewing on Route 33 in Hamilton Township. Hamilton Township in Mercer County is fortunate to have many fine businesses that serve our community. Saul Funeral Home is a fourth-generation family-owned business proud to support our local schools and community. Their compassionate and caring staff is there for you and your family. They'll bring the closure you deserve while also celebrating the life of your loved one. Visit their website at saulfuneralhomes.com. That's saulfuneralhomes.com. Saul Funeral Home at 3795 Nottingham Way, Hamilton Square.
Well, welcome back to This Month in Hamilton. Want to again start out by thanking our sponsors, Capital Health System, Haldeman Ford, Saul Funeral Home, and Kessel Dermatology. So, Doctor, first, thank you for the education, right? But I know part of what you just talked about in the last segment was what you go over with your patients, right?
Right.
So for patients, and we'll get into maybe in a second, right, what symptoms they have before they do see you or should see you, right? But if they want to see you, right, maybe they've been thinking of seeing a cardiologist, maybe they've been putting off seeing a cardiologist. How can they get in touch with you? What is there a number to call, a website to go to? What's the best way for them to reach out to you?
Yeah, thank you. So we are, our phone number is 609-303-4838. That number always gets answered during daytime by our office staff, and at nighttime, in case you are one of our patients, a doctor is always on call who will get back to you quickly. But the 609-303-4838 is our practice number.
Okay. And you still got your office, you said, here on White Horse Ave?
Yes, I'm very active on White Horse Ave. We actually have a big center there with lots of our doctors come here. We have diagnostic testing there, so if you need an x-ray, if you need any cardiac testing, we can do it there. We have a surgical center, we have other specialists, so it's kind of a one-stop shop for a lot of things. So we're definitely in this community. We also have offices depending on where you're coming from. In other townships, we have Robbinsville, Lawrenceville, Hopewell, Newtown even, if you're on the Pennsylvania side. So our practice, we have covered the area, even down to Columbus we have an office.
Oh, wow.
So depending on your geographic area, we have an office near you.
So convenience cannot be an excuse for not coming to see you, right?
Yes, we will make sure, even if our Capital Health has a lot of resources for people who have transportation issues, like let's say you don't drive, or we get, I can't promise this because I don't know how exactly it works, but I know like a lot of people, the hospital helps them with getting an Uber to come to their appointments. We have medical transport that brings people in or takes them back. We have
One of the things even our senior center does is patient transportation for seniors that are part of our senior center. I know the Mercer County does the same thing too. So, there's a myriad of ways to, because we want people to be healthy. We want people to see their physicians, right?
Of course.
Yeah.
So I think if, obviously Mercer County also has a lot of resources for the community as far as transportation and things like that, which I'm not up to date on exactly. But I think just the point is we don't want the barrier of getting to your doctor to be one where you don't get the appropriate care.
Sure.
We want you to be able to come. We have appointments, our particular practice, and this is something that was always very important for us, is to not have somebody call for an appointment and we tell them our first availability is like 4 months from now. And if somebody has heart condition, absolutely do not want them to wait 4 months. We always have availability for you to be seen quickly in our office. I can promise for my own schedule, I always get people in quickly if there's any type of concern. If their doctor calls me and says, I'm concerned about this person, I always get them in. I don't think there's any reason for somebody to sit on heart type symptoms for more than a few days.
So what are some of the symptoms, right? And we talked a little bit just about how the heart works, right? We've talked about how that may manifest itself in symptoms, but what are some of the symptoms people, might be experiencing where you would say you need to see a cardiologist? You might want to think about seeing a cardiologist, right? What are some of those symptoms?
So symptoms that would be red flags for a heart problem, one would be chest pain. Chest pain can be anything, but if you got hit in the chest by something and now that particular spot hurts, clearly that's not your heart. But if you're having more of like a vague type of pain, it's in the middle of your chest. It doesn't have to go down your arm or not, but if it's new to you and you haven't had that before and there's no obvious cause for it, especially if it gets worse when you exert yourself and gets better when you rest, that's concerning. So chest pain is concerning. If you're getting short of breath more than you used to, now people come in different levels of exercise capacity, people get short of breath with things, but if it's not something you're used to, like let's say you used to run a mile in 10 minutes and now you can't, and now you just get short of breath, like running 300 feet, that could be a red flag. Why are you getting short of breath, which you weren't before? So use your own baseline. If you feel like your heart's racing and you're not doing anything and it's just your heart's racing, that could be an arrhythmia. So that's another type of symptom. If you're passing out or almost passing out, that can be a sign of heart disease. So that's something you should mention to your doctors. If any of these things are anything more than mild, anything that's persistent and just not getting better quickly, for that you should go to the hospital, because that could be a sign of something that's emergency. And we always say, if you're having chest pain and you want to go to the hospital for chest pain, let's say it's not mild, it's not getting better quickly, and you're concerned, don't ever drive yourself, because you don't know what's going to happen on the road. Number two, don't have your family member drive you, because if you have your family member drive you, there may be a delay in getting you seen quickly. Call 911. 911 is the best way for any type. If you're concerned about your heart, just call 911. They'll get to you quickly. Fortunately, in this community, we have good, emergency service who will get to you quickly. And once they put you in an ambulance, if anything happens on the way to the hospital, they're equipped to deal with it. Also, they can call ahead to the emergency room. Let's say you are having a heart attack. They do an electrocardiogram to diagnose a heart attack. And let's say they see in the ambulance that you are having a heart attack. They can call ahead to the emergency room, and this is done all the time, where the emergency room is prepared that you're coming, and so they get everything ready in case they need to do an emergency procedure on you. They call the appropriate doctor, so they're ready. Certain types of, this is not for every type of heart attack, but certain types of heart attack, and we don't know this until we do an EKG. The goal is to open up that blockage. We talked earlier about a blockage causing a heart attack. Within 90 minutes of you coming in to the hospital, That's called door to balloon time. That's the medical lingo for it. So door to balloon time means door, meaning the door of the emergency room. From the time you hit the door of the emergency room to the time the balloon is the balloon that they put in
Inserted.
your coronaries. So the difference between those two times has to be 90 minutes or less if we want to save the heart muscle. Because once the blood flow is obstructed to your heart, that heart muscle, we talked earlier about how heart muscle needs constant supply of oxygen and nutrients. And so the time limit seems to be about 90 minutes, where the heart muscle might have reserved for 90 minutes to recover if you open it up quickly. But once you miss that time window, then the heart muscle starts to die. And once that heart muscle starts to die, it'll never come back. So you end up with part of your heart that's not an effective muscle, but the scar. And so that ends up causing you problems down the line with congestive heart failure and arrhythmias and things like that. So it's important to get that blockage opened up really quickly if you want to give you the best chance of living healthy for a long time. And so getting back to the 911, calling 911 is the best way to get you in quickly, get you treatment quickly, and give you the best best chance of long-term health.
Perfect. Some of those symptoms, right? I think so many people just assume, oh, I'm not going to worry about my heart till I'm 50, 60, 70. I assume you see patients in their teens and 20s even too.
We see occasionally. Fortunately, it's not common to have for a younger person to have heart disease, but they do come through for sure. So if you're not sure, don't assume that it's nothing. Just tell your either primary care doctor about it or call us. We're happy to get you checked out. Now, if you come in and you tell me about your symptoms and it's obviously nothing concerning, I'll tell you it's nothing concerning. Enjoy being 25. But if it is something that concerns me that needs being worked up, that's how we would know. It's better to know than not.
Absolutely. So, Doctor, we just have a few minutes left, right? What do you want our listeners listening today, again, February Heart Health Month, right? Your practice, what you're seeing. What do you want to leave our listeners with as we finish up here today?
So we talked earlier about how we're so much better at treating heart disease, and heart disease death rates have plummeted so much. It's not over though. Heart disease is still, after all that, the number one cause of death. So think about it. If you're just concerned about your family history, if you're concerned about prevention, call us. We're happy to review your risk factors with you and just come up with a plan where we can keep you healthy for as long as possible. If you're having symptoms like we talked about, again, call us. We'll review your symptoms with you, make sure that it's not any sign of some kind of undiagnosed heart condition. And if you have heart disease, make sure you see your doctor at least once yearly unless you have symptoms. If you have symptoms, then go sooner, but at least see them once a year if you've had ever a stent put in, if you've ever had a heart attack, a bypass operation, to make sure that you're on the appropriate meds, to make sure you're on the appropriate dosage of meds, that you're getting the appropriate follow-up.
So much of that preventative care
for
almost.
Prevention. And also, state of the medicine, state of the art changes. Compared to 16 years ago when I started, the way I practice now is significantly different because we have so much new technologies, so many new devices, testing, medications that we have, and without getting too technical, there's a condition called TTR amyloidosis, which is something that's way underdiagnosed, especially in the African American population, where it gets misdiagnosed as just high blood pressure, but it turns out that it's cause of significant morbidity. It just has been underdiagnosed. Part of the underdiagnosis was just under recognition of it, and part of it was that we never really had good treatment for it. So people were saying, even if you have this condition, what am I going to do? There's no treatment for it. But now we do actually, for this particular condition, have effective treatments that work really well. So now we're becoming more aware of it, more the need to look for it, because we can actually make a big difference for people who have it. So I'm using that just as an example of, state of the medicine is changing, and so there's new treatments, and just as an idea to make sure you get seen on a regular basis, so that things get updated, and make sure that your medications are updated, your testing is updated. So I think that would
all right.
that would be ideal.
Thank you so much for joining us today. Right, appreciate it. I know our listeners, whether they have heart conditions or not, Appreciate hearing from you, right, and your expertise, and all the good work you and Capital Health System are doing each day to, as you say, keep our community not only heart healthy, but healthy in general. So
Yeah, my pleasure to be with you.
Yeah.
Like I said, Hamilton is a place I started, and special place in my heart.
Well, we approved the sidewalk, so now we expect to see you walking up San Melito Drive here a little bit. So, and thank you all for joining us again this month in Hamilton, our February 2025 edition. Want to close by thanking WBCB 1490 AM as well as our sponsors, Capital Health System, Haldeman Ford, Saul Funeral Home, and Kessel Dermatology. And with that, we'll see you in March, and I hope to see you March 8th at the St. Patrick's Day Parade.